Assalamu alaikum, how are you?
Good.
So, doctor, what's your name, my dear? Please introduce yourself.
My name is Mohammed Al Yusuf, medical intern.
Okay. And Dr. Muhammad Yusuf, my name is Dr. Ambreen Haq, and I've been working here as a consultant, obstetrician, and gynecologist. I have got 20 years experience of working in OB/GYN, and it's a pleasure to take you on a journey towards preeclampsia. You heard about the word preeclampsia?
Yes, it's a term of like three things: hypertension and proteinuria, plus and organ dysfunction.
Okay, that's wonderful. So, what do you see in my slides here?
Again,
What do you see in my slides here?
preeclampsia, a bird eye view.
So it's such a huge topic, you see. So like the birds fly in the sky and then they stop and look at something and then they pick up something good and then they go away. I'm going to be stopping my birds everywhere, right? And this is the theme that I've used for this huge presentation. Okay, a background about myself. You see, this is a background about myself where I come from Pakistan, and this is the first hospital that I was trained in. It's called Pakistan Institute of Medical Sciences. Then I worked in Islamic International Medical College, which was Rifa Medical College, University of Islamabad, then in Pakistan Atomic Energy Commission, and then I ended up in Bahrain, in King Hamad University Hospital, and then I stayed in Ali Medical Center in Islamabad for some time, and then back to Saudi Arabia, where I worked in King Abdullah University Hospital in Bishop. So all these hospitals were teaching hospitals, so we've been teaching students like yourself, and practically the basic things, same things, OB/GYN and its emergencies. And this is my short journey from Islamabad to Saudi Arabia, and do appreciate the mountains that I come from, and let's get on to the subject. So the reason why we are talking about preeclampsia today is that preeclampsia complicates about 2 to 8% of pregnancies globally, and it is responsible for 1/4 of deaths which take place in the mothers during delivery or delivery related causes. And this high mortality is not just in the around the Asian countries, or where the countries where there is very high mortality rate. It also is a problem in the Western world, or where the health systems are excellent. Even there, 6% women die of pregnancy-induced hypertension. And a few studies from Saudi Arabia, it's like I found that there was incidence of 20% in Arar. You are aware of this area, Arar?
No, what is it?
Arar in Saudi. You know about Riyadh, of course.
Oh, Arar, you mean?
Arar, okay. So which part of Saudi is this, Arar?
On the north side.
Northern side. So you see, like in our northern areas where there are too many mountains and all, it's difficult for patients to come for antenatal care, or maybe to reach in time for delivery. So there is, the incidence is higher. In Al-Hassa, in one of the studies, it's 19%. And in Riyadh, there was one study that showed 2%, but in our own hospital, we have discovered it's almost 20% preeclampsia. So, the International Society of Hypertension, they meet almost annually, and they have classified the pregnancy-induced hypertension into four major components. One is preeclampsia, eclampsia, HELP, and the other one is which is the severest form, like preeclampsia, eclampsia, and HELP. You've heard of these terms?
Yeah, like I said, preeclampsia is a condition where is the hypertension during pregnancy and proteinuria plus end organ dysfunction.
Perfect.
Eclampsia, it comes the same, but with the active seizure happens.
Yes.
And the HELP, it's abbreviation for hemolysis, elevated liver enzyme, and low platelets.
Perfect. So, the most important bit of preeclampsia. Second is chronic hypertension. The woman is already hypertensive and she gets pregnant, and then she proceeds into a pregnancy. So she has preceding history of hypertension. And the third one is superimposed preeclampsia on chronic hypertension. That she gets preeclampsia in addition to chronic hypertension. And then there is a category which is benign hypertension or gestational hypertension that only happens during the pregnancy. So, what is the definition here? The definition is that gestational hypertension is one or more of the following, right?
Right.
New onset conditions at or after 20 weeks of gestation. At or after 20 weeks of gestation.
Okay.
And it may include blood pressure rise, may have proteinuria, or may have maternal organ dysfunction. Now, what are the maternal organs that can be affected by it?
Maybe liver,
Yeah,
kidney.
perfect. So, liver will show high liver enzymes, ALT, AST. Kidney will show high creatinine levels. And then liver, when it swells up, how will it feel per abdominally?
Like right upper abdominal pain.
Yes. So right upper quadrant pain or epigastric pain. So a patient comes with blood pressure of 130/90 and is complaining of epigastric pain, and she is 26 weeks pregnant. What would you think she has on the strike of it?
Like gestational hypertension.
Could be. So first thing that you will do to distinguish it from gestational hypertension to proteinuria would be to test
The urine
yes.
for the
Now, if there is 3+ proteinuria, then what would it be?
preeclampsia.
It would be preeclampsia. See,
Right.
you got yourself to the diagnosis. Now, for example, she has neurological complications, like she's having fits, or she's having a altered mental state, or she's complaining of sudden blindness, or she's complaining of some spots coming in, which we call scotomata.
Again, what you got?
Scotomata,
Okay.
blurring of vision, or little black spots, right? So
Right.
that means that there is so much edema in the retina that she is unable to see
Okay.
right properly, and then she gets these spots. Why? So that means that there is effect on the neurological complications. Then, if for example her platelets have fallen down, like in DIC or in hemolysis, or there is uteroplacental dysfunction, there is baby's growth is affected. So we will continue with the definition throughout our talk about preeclampsia, right?
Okay.
And my job today will be to tell you how preeclampsia affects the mother and the baby, right? So the mother can have eclampsia, HELLP, pulmonary edema, cerebral hemorrhage, cortical blindness, DIC, renal failure, hepatic failure, or death. And the fetus can have IUGR, can have low birth weight, can be premature, can have stillbirth, can have neonatal mortality or morbidity. So that's the reason why we want to learn everything about preeclampsia, right?
Okay. Right.
So with this introduction, I will quickly go on to the symptoms. As you described, there is high blood pressure.
Yes.
Could you please tell me what is the high blood pressure that you expect?
The systolic could be more than 140. Diastolic could be more than 90.
Right? Now, once you have seen it once, like patient has come in, she's checked her blood, checked her blood pressure, it was 140 by 90. So you will label her as preeclampsia or gestational hypertension, or what would you do?
I will do further investigation
Yeah.
and repeat the blood pressure.
So that means that you will, the most important thing in definition is that you recheck the blood pressure after 4 hours.
After 4 hours?
Yes.
Okay.
Now sometimes in a VZOPD it's not possible. So what do? We send that patient to the labor room, or we recheck it after an hour or 2 hours, and then we see, was it because of fear of the hospital, which is very rare. It will not raise blood pressure so much, but well, sometimes patients are anxious or something, or the cuff wasn't properly applied, the blood pressure reading can be wrong. And that's why it is very important to recheck. And 4 hours is the time. Now, if this blood pressure is risen, you see this after 20 weeks, what do you say? Previously it was a normal blood pressure, and now it is after 20 weeks you see a rise. So you
Gestational
will call it
hypertension.
right? Now, if the blood pressure is more than 160 by 110, it is severe hypertension,
Severe.
right?
Right.
And severe hypertension can be confirmed within a short interval. You don't wait for 4 hours, okay, to complete your diagnosis. Here, few minutes, and you start with the therapy. Now, these are the symptoms which we talked about: headache, flushing of lights, epigastric pain, edema, vomiting, blurring of vision, diplopia, confusion, dizziness, fits, convulsions, loss of consciousness, IUGR, fetal death. All these symptoms can be part and parcel of preeclampsia. You can read about maternal risk factors, but remember, primary gravida herself is a risk factor. Multi-fetal gestations, like twin pregnancies. Yeah. And I'm going to tell you a story. I had a patient. She was expecting twins, right? Perfectly normal, her pregnancy was going. 32 weeks, she was sitting with her sister-in-law in the kitchen, talking to her. Suddenly the sister-in-law realized that the girl stopped talking, and then she fell on the floor. And there she started fitting. So immediately they took her to the hospital and they diagnosed her to have eclampsia. And she was given the right medication and she was immediately taken for
Uh, protein or
what is the treatment of eclampsia?
eclampsia.
Ultimate treatment of eclampsia. After control of hypertension and control of fits and stabilizing the patient, what will you do? Send her home. Send her home.
Okay.
Will you send her home? No. We are going to deliver.
Okay.
You get my point?
Yes.
See?
Immediate delivery.
Yes, you stabilize the patient. You make sure that the baby is viable. So I mentioned 32 weeks, right?
Yes.
32 weeks, baby is mashallah viable. Baby is going to be thriving in the nursery. It's good weight. You have not one, you have 3 patients now. Twins. 1, 2, and then the mother. So you have a responsibility to deal with eclampsia immediately, give the right medication, give the right treatment, and then most important, definitive treatment is delivery. So, have you ever thought, my dear, how it happens? What is the pathophysiology behind this?
I don't know.
Okay. So, in a normal pregnancy, there are blood vessels which are supplying blood to the fetus.
Yes.
Through what? Through the umbilical cord.
Yeah.
Right? Now, those channels are at the transmitting tube.
Mm-hmm.
So, by around 16 weeks and 18 weeks, what happens is that these are the arterioles, right?
Right.
It has 3 layers, 1, 2, 3. The intimal layer, the central layer, it starts getting replaced with these vessels, which are the decidual vessels, and it causes dilatation of the spiral arterioles, right? Normally this happens, and this whole layer will be replaced by maternal cells or testiculization. And you know what happens? They make the arteries less contractile. They don't contract to impulses. So you may have seen in the movies what happens when a pregnant woman has an accident. Can you recall a movie where you've seen a pregnant woman having an accident? What do they generally show? What happens to the mother and the baby?
The mother died, the baby survived mostly.
Okay. Or the baby dies
Mm-hmm.
and mother survives. But in real life, it really doesn't happen. A mother and the baby, unless and until it's like a fatal accident where God forbid you lose a lot of like you lose yourself or you lose a family, or it's like the impact is really so huge. But minor incidents of accident or fall or something, mother will be okay and the baby will be okay. Only she will come to the hospital, get an ultrasound done, and she would be okay, right?
Right.
So the story is that this mechanism prevents sudden changes in the blood pressure and sudden changes which can happen in the fear, fight or flight level. So I will not get into these heavy details, but I will go back to the definition. I want you to read this out yourself.
Preeclampsia is a common and potentially lethal multisystem disorder
Yes.
of pregnancy defined by new onset hypertension and proteinuria after gestational week 20 or new onset preeclampsia associated
Signs in the
signs.
absence of.
in the absence of proteinuria.
Perfect. So these are the organs which I told you about: the liver, the kidneys, swelling
Edema,
of the feet,
okay.
lung. So can you see that it is affecting preeclampsia? This blood pressure is affecting every organ.
Yes.
Why? Because there are blood vessels. So it is a vasculopathy, and it is a generalized vasculopathy that all the vessels are pathological. Okay?
Okay.
Again, we go back to the diagnosis of preeclampsia, because if you know this diagnosis, you will never miss a patient who needs your attention.
Inshallah.
Right?
Right.
You will remember this?
Yes.
So, criteria is more 140 by 90, more than 4 hours apart on 2 occasions, after 2 weeks, or in a previously normotensive patient, or 160 by 110, and you rechecked it and it is the same. Proteinuria more than 3 grams in 24 hours, platelets count less than 100,000, serum creatinine more than 1.1, liver transaminases twice the upper limit. So for example, if ALT was 12 and it has become 24, it has to strike a bell, even though it is under 40 under normal conditions. But for a pregnant woman, it is significant, right?
Yes.
32 and it has become 63. It is important, right?
Right.
So twice the upper limit of the normal concentration, pulmonary edema, new onset or persistent headache which is not going away with analgesics, and visual symptoms. So all these, after 20 weeks, these symptoms along with blood pressure is a problem. Now can you see, or new onset of proteinuria? Now here, new onset of hypertension after 20 weeks, in the absence of proteinuria, can you still make the diagnosis? Can you make
Yes.
the diagnosis?
Yes.
If there are accompanying symptoms of organ failure. Now, if liver enzyme is high, blood pressure is high, she is having visual symptoms, you will say no, she doesn't have preeclampsia because she
No.
doesn't have proteinuria.
No, she has preeclampsia.
Yes. So, when you started with your concept, my friend, in the beginning, you included proteinuria in your definition, right?
Right.
And you were right, because traditionally, for the past 100 years, we have been hearing this. And I'm not 100 years old, but anyways, like for the past 20 years that we started learning OB-GYN, our definition included hypertension, blood pressure, proteinuria, and organ dysfunction. And we used to look for tightening of rings, fingers, and our test included that we must tell that the woman cannot wear her rings or cannot wear her bangles, or her feet are swollen and she doesn't fit in her shoes.
Okay.
Well, that part of the definition is out, because if there is high blood pressure and there is raised blood pressure, there is raised liver function test, or she is having end organ failure dysfunction symptoms,
Okay.
Without proteinuria, it is possible because maybe the kidney is spared, but the rest of the organs are affected.
Yes.
Okay? So you make definition accordingly. These are the risk factors, and this is the pathophysiology explained in a very nice manner. I'll send this as your handout and you can read this well. So, same issue: thrombocytopenia, renal insufficiency, impaired liver function test, and pulmonary edema. Any questions so far?
No.
Hmm?
No question.
No question? You've understood everything?
Yes.
So then we talked about the four types of the classification that we did.
Yeah. Gestational hypertension, chronic hypertension, preeclampsia, and eclampsia.
Right. So I'm going to be further building on all these things, but I think for today's session we will stop here, and I will provide you with a small recap of the effects of and in the next session we'll be able to finish this huge topic, right?
Right.
Now tell me that so far what have you understood?
Like hypertension in pregnancy is very serious.
Perfect.
Need immediate action, early recognition, and maybe it will indicate for immediate delivery.
Yes. And what are the conditions that it would indicate normal delivery, like immediate delivery?
The preeclampsia and eclampsia,
Yes.
and HELP syndrome.
Perfect. Because they can cause maternal death.
Yeah.
So, for tomorrow, I would want you to read up about the management of this patient, and I'm going to give you some scenarios to deal with, and then we'll perform a drill of eclampsia.
Okay.
So that we can, recap, and this subject of high importance is instilled in your mind before you leave this rotation.
Okay.
Okay? So take care, and do ask me any questions whenever you think you have anything in mind. Just send me a WhatsApp message and I'll be there.
Inshallah.
Thank you.